Yeah, it's been an interesting ride for her. Of course, my mom too. And by the way, if you're good morning, folks. If you're just joining us, we're gonna allow others to join us as well. So we're gonna wait maybe 2 minutes, and then we're gonna start the program. And I asked my mom to. We actually bought like an elliptical machine. We have an elliptical machine at home and a treadmill, but she does the elliptical machine because it's treadmills for older folks are a little bit dangerous. uh, but she can control the elliptical machine, so I asked her, "Get on it, mom," and so she's been doing that every day. It's because back in the Philippines, she actually walks a lot, but here, especially during the summer months, it's kind of hard to walk outside.
Yes. 79 is the new 59, right?
Yeah, why not? Again, good morning, folks. If you're just joining us, we're gonna wait maybe one more minute, and then we're gonna start the program. All right, I think we are going to start. Good morning, everybody. My name is Luigi Del Puerto. I'm the associate publisher and editor of the Arizona Capital Times. The Arizona Capital Times, of course, covers state government. A lot of people refer to us as a nonpartisan, non-ideological, independent newspaper. I kind of refer to ourselves as an equal harassment newspaper. If you don't have a subscription, let me know. I'll get you squared away. We have a very important subject to talk about this morning, which is holistic health. But first, I want to thank our sponsors for engaging with us this way. The Arizona Naturopathic Medical Association is the trade association representing naturopathic physicians in Arizona. Its vision is to ensure the growth of naturopathic medicine in the state, and the association seeks to unite naturopathic physicians as effective community leaders for the profession, for patients as well. The group upholds integrity, productivity, and professionalism. It serves by providing education and support to naturopathic physicians and their patients. Also, a sponsor is the Arizona Governmental Affairs. It is among the most established lobbying and government affairs firms in Arizona. The Arizona Governmental Affairs has a long record of success. It crafts thoughtful strategies, getting directly to the point, and acting tirelessly to move forward with the interest of clients. The firm has represented a wide array of clients, from high-tech firms to the insurance industry to K-12 groups, and on a wide variety of issues such as substance abuse treatment, autism treatment. The firm is led by Gretchen Jacobs, who combines aggressive smarts, undogged coalition building to get results. Again, I want to thank the Arizona Naturopathic Medical Association and the Arizona Governmental Affairs for sponsoring this morning's discussion. We have a great panel this morning. Joining us is Dr. Kristen Bishop, NMD. Dr. Bishop is a naturopathic physician in private practice and director of the residency program at Keystone Natural Family Medicine in Mesa, Arizona. Did I get that one right, Dr. Bishop?
You got it.
Right,
yes.
Okay, perfect. So she is also the legislative committee chair for the Arizona Naturopathic Medical Association, an Arizona delegate for the American Association of Naturopathic Physicians, and a member of the Healthcare Policy Committee for Congressman Andy Biggs of Arizona. She is a sought-out presenter for various community and professional organizations throughout the state. Dr. Bishop holds a Bachelor of Science degree from Bowling Green State University, Ohio, and earned her medical degree from Southwest College of Naturopathic Medicine, which is an accredited four-year medical school in Tempe, Arizona. She has been awarded the Advancing Naturopathic Medicine Award in 2016, and the Physician Volunteer of the Year in 2018. Dr. Bishop, thanks for joining us.
Thank you.
Also with us is Dr. Stephen Katz, NMD. Dr. Katz has worked for Naturopathic Physicians Group since 2013. During his clinical education, he spent a year and a half working at the Southwest Center for HIV/AIDS, where he developed protocols to strengthen the immune system's ability to fight both acute and chronic illnesses. Dr. Katz also spent 2 years working in alcohol and drug rehab centers, utilizing many naturopathic modalities. He was trained in IV therapy protocols, as well as how to properly detoxify patients and help restore health balance. He has helped several patients with neurological conditions such as anxiety, depression, and insomnia, in addition to many chronic conditions like diabetes, cancer, and heart disease. Dr. Katz is an expert in pain management, and he also treats digestive disorders. And in 2016, he was elected as the State of Arizona Naturopathic Medical Association president, and he is the president of the association to this day. Dr. Katz, did I get all those correct? And welcome.
That sounds like me, I think.
Awesome. That's what I want to hear. And finally, we have Representative Nancy Barto, who represents Legislative District 15. Representative Barto chairs the House Health and Human Services Committee. In this role, she is responsible for overseeing Arizona's health and welfare agencies and boards. She is a member of the Judiciary and Education Committees, and she has sponsored numerous healthcare reforms, and she has worked to ensure that affordable healthcare options that protect fundamental freedoms can flourish in our state. She's recognized as a leader for Arizona families. She has introduced and led important property tax and homeowner reforms into law, and she has been a voice for reform and accountability in Arizona's foster care, corrections, and behavioral health systems. She also served as co-chair of the Child Safety Oversight Committee since 2013. And prior to joining the legislature, Representative Barto enjoyed a career as a mother, community volunteer, and public policy advocate. Representative Barto, thank you for joining us.
My pleasure. Thanks.
All right. So if you're viewing or listening to this morning's morning scoop, please don't hesitate to send in your questions via the chat room or via the Q&A room. We'll try to get to as many of them as possible toward the end of our program. So send in your questions. I want to ask Dr. Bishop first to give us some sort of a primer as to what is naturopathic medicine, and how is your practice the same or different as a practice of, somebody who is an MD, for example?
Okay, perfect. So naturopathic medicine and medical training is almost identical, as with osteopathic or pretty much any medical training. We do 2 years of didactic, and then we do clinicals as well. We do have residencies. They're not mandated yet because we're not funded by the federal government for those residencies, so we have to self-fund them. So we're working on growing that program because we see the importance of having a residency. My practice, I do primary care, but I run a model that's called direct primary care. So what that is you don't use insurance for primary care. So I do believe people need insurance for catastrophic things, hospitalizations, things like that. But we can do primary care incredibly affordable. So people pay a monthly membership fee, and then they have unlimited access to their physician. So what that would mean is, if you're sick, ear infection, sore throat, any of those types of things, we would see for that. We also see you for your wellness. And I think what is different about naturopathic medicine is we are more committed to the wellness side than the sick side. I was sharing with Luigi earlier that our patients really don't even come in when they're sick because we've trained them what to do from home. We can easily call in antibiotics if needed or something to that effect. But typically people are in the office working on staying healthy. So that might be doing IV therapy, getting in the sauna to do some detoxification, learning about nutrition, balancing hormones, balancing thyroid conditions, things of that nature. So we do the full spectrum, from sutures to medications to wellness to nutrition counseling to, whatever people need. So it's great. And my goal of being a primary care physician was to be kind of that old school doctor where I really know our patients. If somebody walks in the door, I can pretty much tell you their name, their children's name, even probably their dog's name. That's the kind of practice that we have. So that's why I chose naturopathic medicine and why I love it.
So let me just follow up with a quick question. When you say direct care, so that means a family, for example, would pay your practice a monthly fee, and that would include what kinds of services would they get for that? And typically, how much would it cost if there's such a thing as a mean or an average?
Sure. So our primary care model is $50 a month if you're 50 or under. 51 and over is $75 a month. A lot of people will use a health savings account, so they use their tax-free money to pay for that. And then you can add children for $20 a month with a paid adult. I would say the average, it's hard to say because some people still have insurance that they will use for imaging and labs and things like that. But we've also negotiated great cash pay rates on that. So for example, with insurance, an x-ray is typically about $150 and our cash pay rate is $27. So it's a huge cost savings for families. And sadly, during this pandemic, a lot of people have lost their employment, which in turn means that they've lost their insurance. And so we've had a lot of referrals because their friends and family who come to us have said, hey, don't lose out on your primary care physician just because you lost your insurance. So the demand has been really crazy, which is good. But it's hard to, I guess I couldn't give you an exact amount because it would depend on your family size and how often you're utilizing it. But you would never ever pay for a visit when you come in. And a lot of people were telling us, hey, just don't even run that through our insurance because by the time we meet our deductible, it doesn't matter anyway. So we'd rather pay cash. So that's sort of what led us to this model of healthcare.
Thank you.
And to piggyback off that real quick too, though, is a typical new patient visit, seeing a naturopathic doctor ranges, but I never really hear before less than 45 minutes. Oftentimes they can go well above an hour. So we're not just, what's your symptoms? Here's your treatment. We're actually trying to get all of the history, really break everything down so we understand what's going on, how it started. We then, can choose what is the appropriate testing to do for that patient to find the cause of the problem. And then we can address the cause, which is ultimately the only way to stay well.
So what does it take to become a naturopathic physician? What kind of training would you be getting? Or would you need to be able to practice it?
I mean, like any, doctorate, you have to have your 4-year undergrad first. Once you do your 4-year undergrad and you have to complete all of the prerequisites to apply for the college, you then have to go through the interview process and then you start the program. Again, the program's a 4-year doctoral program. And then you have to pass 2 sets of boards. After 2 years with your didactic courses, like Dr. Bishop was saying, you have a 2-year board. And then after you graduate, the last 2 years are very heavily clinical hours, seeing patients in person, learning the protocols, learning, how to heal people. And then you have to pass a 4-year board after you graduate in order to get licensed.
So at the very least, you get 8 years of schooling, and then whatever additional training is required, correct?
Correct.
So Representative Barto, I know that the state has been, I think really for the state, the big issue is trying to manage the cost of healthcare. And the idea then is that if you can manage the cost of healthcare better, then you can allocate state funding resources for other priorities, right? K-12 or public safety or whatever it is that's pressing. So from your end, how do you think a more holistic approach to care, which is what you've heard from Dr. Bishop and Dr. Katz, could help the state, manage the cost better?
Well, I think it's a really important question we should be asking more and more because, government plays such a huge role in healthcare right now. and the costs just keep rising. If we don't do something different going forward and help people to manage their own health better, take more responsibility, if I dare say that, then I think government will end up looking at an overwhelming increase in costs going forward. So it's a very important decision or topic to cover, because especially in a time when we are going through economic turmoil. We were seeing our Medicaid numbers go down as our employment numbers rose, and more people are back to work, gainfully employed with insurance. We've done a lot with passing affordable healthcare insurance options in this state. We're a leader in that, in allowing a lot of patient choice. Where we get in trouble is, when people start losing their jobs, then our Medicaid numbers go up, and then we have less revenues coming in to support that. So it's a backwards, upside down cycle that nobody in government looks forward to handling. So we have to constantly be looking at how we can stay out of the way of patients taking more responsibility. And I think part of that puzzle is helping government not get so involved, be so involved in regulating healthcare. And we do that too much on a regular basis, from my perspective, by looking at scope of practice issues, not allowing healthcare professionals to practice at the top of their game, their top at their skill level that they've been trained at. And so, we see this in scope of practice turf war battles every year, and our current laws prohibit people like naturopaths from even delivering just common health care to their own patients because of the current laws. We had a bill this session, for example, that would have dealt with a lot of little things that any other medical physician could handle, such as writing a student's absence from school excuse. You've got a family that goes to a naturopath and their children, and okay, they need a doctor's note. They have to go to another doctor to get that. It's just one of the examples where it doesn't make a lot of sense, and it also inhibits patient choice. It's more expensive, and when you're constantly putting up barriers for patients, they'll just throw up their hands and say it's easier to just go to my regular primary care. And then there's a lot of examples where we can do a lot better.
So let me ask Dr. Katz about the idea of holistic care. From the state's perspective, I think we've seen the state move toward a more integrated approach to healthcare, right? So the idea for the state, one of the ideas is the state is pursuing is maybe we treat both behavioral health and physical health under one roof. That way we can, if we see a patient, for example, then we're looking not just at the physical side of health, but also on the behavioral side of health. And so, but from at the individual level, what is holistic care? What does that really mean?
Well, I mean, I look at holistic care as treat the whole body. It's wellness. The idea is as Representative Barto said, it's really about patient choice. There's a high percentage of people out there that want to go the pharmaceutical route, and that's their choice, and that's great. And there's a lot of patients out there that don't want to be on a lot of medications. Again, that's their choice. So what we see as holistic care is treat the whole body. Our system is based on diseased management care. When people get sick, they go to the doctor. They don't think of wellness. They get a pill for whatever symptom they're going through. And then if they feel better, great. A lot of those pills, if you're taking them long-term, they'll have long-term side effects to them that people aren't thinking 20 years down the road. So when it comes to wellness and holistic care, it's really about, again, finding that root cause. When you can do correct testing, finding the root cause, you can then prevent that illness. You can get that illness better, but then you can actually prevent it from getting worse, as well as preventing future things. There's lots of patients out there that get an autoimmune disease. They're very likely to get multiple autoimmune diseases then, because their immune system is all over the place at that point and it doesn't really know what it's doing anymore. So when you can get to the fundamental side of finding that root cause, you can prevent a lot of those down the road issues. But if all we ever focus on is, I have a symptom, let's treat the symptom, we're always, it's a losing battle forever.
So the idea then is that maybe you can, the whole idea, and correct me if I'm wrong, you're the one who knows this issue better than me, but the idea then is really prevention, right? So and living a healthier lifestyle so that you're not having chronic illnesses, and if you have chronic illnesses, then maybe trying to find a way to get to the root of your chronic illness and treating it there, and then the idea is that it will solve a whole lot of other
Huge.
Potential chronic illnesses.
Think about it from a standpoint of every test we get when we get our annual tests from our doctors. How many of them are truly preventative tests? You get your blood work done. If something's wrong in your blood work, what did you prevent? If you get a mammogram and someone already has breast cancer, what did you prevent? You might have prevented it from getting worse, but you didn't do the steps necessary potentially to protect you from getting breast cancer in the first place. I'm not saying don't get your labs and don't get your mammograms. Of course, those are really important tests to do. But the idea behind it is if you already have something wrong with your labs and scans, the issue's already there. Like there's ways to protect your body and prevent those issues. Nothing's perfect, of course, but there's ways to protect yourself where you have much less risk of developing some of those, really awful conditions.
COVID-19, I think, has exacerbated and magnified many of the problems in healthcare that we're seeing. And I want to ask Dr. Bishop, what are you seeing in terms of the kinds of problems that the patients are coming to you for? And it's hard to say how do you treat them, but give us some sort of an overview in your approach to dealing with these problems.
Yeah, absolutely. Just to kind of piggyback on what Dr. Katz said, the holistic approach has been really important right now because we're dealing with so much anxiety and depression and families who are struggling and kids who the parents, literally sit in my office and cry because they feel their child might need antidepressants. The isolation has been horrible on people. And so that is that holistic approach where we have to take care of the whole person. As far as the virus itself goes, when this pandemic started, we did a lot of webinars and we taught our patients what to do preventatively. And we have about a patient base of about 3,000 people, and none of our patients have had anywhere near a hospitalization. They've all had mild symptoms of those who have gotten it. So 0 to mild symptoms. But we treat very differently. So we get in the game early. That's part of the prevention. So if someone gets sick, and this is not just in COVID times, this is anytime. If they get sick, they know to start their vitamin D, to start their vitamin C, to eat healthy, to potentially juice, to make sure they're sleeping. Then they can come in and do vitamin C IVs. And there was some good research out of New York on using the vitamin C IV in the hospital. One of the pulmonologists did that to help with the acute respiratory distress syndrome, which can be caused from that cytokine storm, which is the bad COVID that we all don't want to get. It was decreasing mortality rates up to about 56% with just adding some vitamin C into the protocol that they were using. Should someone need, if someone does get a bad form of COVID, we also can do all the medications, which is, sort of the beauty of naturopathic medicine. It's the best of both worlds. And, naturopathic doctors, I do want to say, have been licensed in Arizona since 1935. So it's really not a new profession. And thankfully our patients have been incredibly healthy going through this pandemic.
You mentioned juice, and I think I understand what you're saying to juice, but for some of our viewers and listeners who might be wondering what does to juice mean? What is it exactly?
Perfect. So juicing fruits and vegetables, the reason we do that is because it has so many of the nutrients and cofactors that the body needs to mount the immune response that it should. You know, I think sometimes we lose sight of the fact that our bodies were created to deal with viruses. We have an innate immune system and an adaptive immune system. And so, I mean, just historically, if our body couldn't deal with a virus, we would all be dead by now. But the juicing brings those nutrients from the fruits and vegetables. So magnesium is needed, vitamin C, vitamin A, vitamin K, you know, all of those great things that are in fruits and vegetables we can extract with juicing. And it's a little bit better absorbed. That's why I like the juicing rather than just eating that. But we can use food as medicine to help support our own immune system to make sure we do have that mild form of any illness.
So Dr. Katz, just real quick, sir. So somebody comes, you know, family who's been with you, or maybe a new family, comes to your office and say, look, we've been holed up at home. And by the way, I've been holed up at home. I've been hunkered down here at home since mid-March, and you know, my kid hasn't been to school since mid-March as well. And so we've been together for a couple months now, and that's created, you know, I'm forever grateful for the opportunity to spend 24/7 with him, but he misses his friends. He doesn't have any physical interaction with them. It's trying to catch his friends via Zoom or Messenger or you know, FaceTime. That's difficult. So and a lot of times he would come to me and say, I'm really sad because I can't see my friends. So there are various problems that we're seeing as a result, you know, not necessarily in my case, but anxiety. So we've seen anecdotal evidence of that, depression. So family comes to you and with all these symptoms, potential symptoms of depression or anxieties, how do you manage that?
Well, I mean, in general, every family's different. Every case is different when it comes to it. So you kind of got to, you know, discuss what things bring that family pleasure and happiness, and kind of, you know, doing any kind of thing with your family that brings pleasure will actually help their overall psyche. Also dealing with, you know, seeing their friends, even if it is on Zoom, letting them, they can still, you know, play games, they can talk, they see each other, doing stuff like that to where they can still interact with their friends, you know, still gives them some of that interaction that they are, you know, losing, you know. But even going into the body side of it too, you know, 80% of the neurotransmitters that are made in that are in our brain, you know, our serotonin, which is our calming neurotransmitter, our dopamine, which is our pleasure neurotransmitter, 80% of those are actually produced in the digestive tract. So again, if they're eating Twinkies every day and they're eating junk food and fast food all of the time, it absolutely affects their psyche every bit as much as, you know, not having that daily interaction. If they're eating healthy and building those cofactors and those neurotransmitters properly, then their body's ability to produce their stress hormones and their body's ability to actually build the brain chemistry to help the body relax and feel good all improves significantly.
So a lot of it is potentially solvable by just eating healthier, is what you're saying.
I mean, it can be deeper than that, but it's certainly more difficult if you don't do that.
So let's talk about access to care. I want to cite a couple of statistics here. You know, for example, we know that Arizona experiencing an acute shortage of active primary care providers and physicians in particular. The U of A released these stats last year. So we're meeting just 41.7% of our primary care physician needs. We're ranked number 44 out of 58 state in total active, you know, physicians. We're at, you know, 77.9 physicians per 100,000 people, and the average for the country is 91.7. Representative Barto, what has been the state's response to really expanding access to care, more specifically with regards to you know, trying to grow the number of primary care providers we have in the state?
Well, I think we've been realizing the tsunami of retirements that are coming, the growth of the population. We see the problem and we know it's there. Like I said before, I think we do two things very well here. We over-regulate healthcare and try and keep out competition, and we also are inefficient at allowing the right kind of therapies at the right time in access to deal with those issues. You know, when we've got so many people entering our state, and still we fight with traditional professionals at the legislature not allowing out-of-the-box thinking, such as what's happened in Missouri, where they're looking at licensing doctors in training, for example, instead of just depending on the federal government's financing our GME, which we need to continue to do, obviously, to train more doctors and get them in residencies. We should be looking at licensing or certifying physicians that have already graduated from medical school but cannot get matched, and get them practicing under another doctor's license so that, you know, patients can be served, especially in rural areas, tribal areas. We've been successful in certain areas, like making sure that CRNAs, certified registered nurse anesthetists, can do their job without supervision and be available. But we've got a long way to go, especially in access. We can certainly make progress by making sure that naturopathic physicians are included in the primary care discussion. Patients should have that option. Again, it allows them to take more control over their health and their preventing disease, rather than ending up having to deal with a horrendous disease that might keep them on Medicaid for the rest of their lives, perhaps, and not be able to work. You know, you mentioned the integration of behavioral health and physical health. That's, you know, the brain is part of the body, and we do recognize that now we have to look more holistically at that. But we spend $455 million. We spent that much in 2019 just on substance use disorder for access patients alone. And, you know, we need more people in the game, like naturopathics, to be able to help with medicated assisted treatment, and we need to get access on board with other therapies that deal with pain management, such as chiropractic. You know, we've still got a huge opioid problem, and it's substance use disorder is one of the big results of shutting down our economy for this length of time. As was mentioned, we're seeing an increase in depression and suicides and suicide attempts. Children are in crisis. Mental health care is a huge issue right now, as are some other results from these state action, government actions. And we need to be looking at all those solutions in order to deal with that appropriately. And let's just take access patients, you know, who are in pain and cannot get a referral from a primary care physician to get their pain dealt with, maybe through a less invasive way like chiropractic. We've been trying to get that as part of the panoply of care for years, because it's less invasive, it can be more effective, and it can keep people from having to be subject to surgery, which is more expensive. So we've had a couple of we've had a couple of good outcomes in that regard. We've allowed access to deliver outpatient occupational therapy to patients on access, and that we're first in the nation on that. So we can be proud that we've gone in that direction. That way, you know, the goal is to keep people, get people back to work, back functional, so that they can eventually, and sooner rather than later, get off of Medicaid. and the state roles. So, you know, there's again, government is kind of behind the times as far as looking at what's new in medication. We shouldn't be getting between the doctor and patient relationship so much, and allow them to really treat patients up to, you know, their level of training and expertise, and let patients have the choice and options that they need.
Dr. Katz, I think you wanted to interject.
Yeah, well, I mean, I bring this up a lot because we've also fought this in DC as well. But, you know, with my licensure as a naturopathic physician, I can write for opiates. So I can be a part of the problem. I'm not, but I can be a part of the problem. But the drug that they use to get people off of opiates, I can't write because we've been
I'm sorry, what do you
blockaded.
mean? What do you mean you can prescribe?
Yeah, like they use drugs like buprenorphine to treat opiate addiction. It saves people's lives. But I can write for the opiates that cause the addiction. I've been blockaded by people in the past from writing the drug that can actually stop opiate addiction. So to me, that is fundamentally flawed on every single level. When people tell us there's an opiate problem, they'll let me write them, but they won't let me treat them. Like, it makes zero sense, never will. And I don't know if anybody on the participant list could hear that and think otherwise. But yet we have been blockaded for multiple years on this very issue as we're trying to save people's lives. Because we're always told it's about patient safety. This is fundamentally a patient safety issue, and we're being told no.
So just so I understand this, under our regulations, you can prescribe opiates. But when it comes to prescribing drugs that wean people off of opiates, you cannot prescribe them.
Correct. And I did 2 years of rotations in drug and alcohol facilities. So I dealt with heroin, meth, alcohol, cocaine, you name it. I dealt with these people on an almost daily basis for almost 2 full years. And the one difference we did is we addressed the brain. We addressed the gut and the healing side of it. We addressed the addiction side. Most addiction centers, they clean you up and send you out. That's not very beneficial to most people, which is why there's such a high rate of relapsing. What we actually do is we try to build those neurotransmitters, the brain chemistry, back up. We do that with supplements. We do that with diet. We do that with IV therapies, because if they have a compromised immune system, we can actually put the nutrient cofactors in the vein directly, so we can actually build the natural brain chemistry. We use amino acids, which are the building blocks to neurotransmitters. So we actually use their whatever drug they were, addicted to. We know what pathways that drug works on in their brain, in their body. So what we then can do is use these treatments to build back those same pathways, so they're blocking the need for the medication in the first place. So we do that from a very more detailed scale than just get clean, send you on the street.
So, Dr. Bishop, I want to ask you about, I think one thing you mentioned earlier, which is that naturopathic physicians can serve Access members under the early and periodic screening, diagnostic, and treatment, which means if a child comes to you via Medicaid or Access, you can treat the child, and Medicaid will pay for that service. But health plans don't cover this.
Yes, so Access has been great. I do have to say that about, we've tried to work administratively with them. As legislative chair, I don't want to get too in the weeds about the legislative details, but we were trying to avoid doing this legislatively because there's a lot of red tape around that. But they were great, and we have about 16 of our naturopathic physicians are registered with the EPSDT program to be able to see children, because Arizona is recognizing that need is there, and parents are asking for that. So I'm very thankful that Access has been so good to work with. However, when we meet with the health plans, we can't get any of the health plans who administer that EPSDT program to actually contract with the naturopathic physicians. So again, it's been a roadblock. So even though Arizona is trying and doing the best they can, there's layers of complexity that we have to work through.
What's the rationale for not covering these in the health plans?
Well, it's been really interesting. It's going to be a lot of logistical work on our end because the formularies that Access currently approves for children doesn't include most of what we would use for pediatric population. Obviously, we don't want to give children medications, so we use nutrients, we use homeopathy a lot, you know, different things like that that Access currently doesn't have on their formulary. As far as the vaccinations, most of our doctors do not stock vaccines because the logistical and cost that it takes to actually administer vaccines in office has been prohibitive for many of our clinics, meaning you have to have a special refrigerator, you have to make sure you're logging the temperature at certain times of the day, you have to log, you know, there's just a lot of logistical things that haven't made sense for a lot of our doctors, and Access would like us to administer in the office. So we're trying to work through some of those barriers. There's a multitude of things that
So
we're
what I'm
working
hearing,
on, but
yeah, so what I'm hearing
go
is
ahead.
that there are kind of established protocols, treatments that have traditionally been, adopted. You're kind of outside your treatment options are not necessarily within the sort of the traditional scope that Axis has, and so that's been a key issue for you.
Yes, and I will say Access has been great. We've had multiple meetings with them, and they would really like to make this happen. It's just the logistical piece of working through it and then getting the health plans to come on board and actually contract with us.
Representative Barto, what other barriers are you seeing? I guess specifically for naturopathic physicians to fully practice their, to be able to fully practice, right, given their training and their experience.
Well, I think we've kind of nailed it. It's a matter of, getting the votes for it. I think we don't like to really point fingers, but that's sort of what it comes down to. You want to follow the money, and where is it going, and who's protecting their turf. And unfortunately, there's just a lot of money in traditional pharmaceutical-based care in government. And I think, it's becoming more obvious all the time. And so, I think this is one of the elephants in the room in government. If government's going to tell people, cover more people, then they control the formulary, they control who participates in delivering that care. And it's going to take, more patients getting involved and letting their voice be heard that, patient choice is more important than government control here, because what we're doing is not working for improving health in this country. And so if we continue, like I said at the beginning, down this path, we're only going to see a further decline in health. People do need to be challenged and have the opportunity to control their health, and government needs to stay out of the way and give them that control. So I think the barrier is really sort of psychological. It's really education, and starting early. We talk a lot about disease in education, and what's our response to it? Well, how do you keep from getting disease, and what's your responsibility for staying healthy? Sometimes we just don't like to go there and connect the dots. My sister's a diabetes nurse educator, and there's so much that's connected to these long-term chronic diseases that are associated with lifestyle and the way that you're brought up. And so, I think what government needs to do is not stand in the way of patient choice's bottom line. And when it makes sense to do so, to look outside the box, we need to get all physicians that are looking at really caring for the patient as individuals and looking at what's best for their health and giving them the opportunity to get that care and not stand in the way. We had an issue, you know, you talk a little bit about the use of medications. We've had issues where off-label drug use by a nurse practitioner brought her license down on her head. She's not able to practice because somebody on that board decided that, you know, wrongly, that she wasn't able to use an off-label drug in a certain way when it was FDA approved, and what, 75% of FDA approved drugs are used off-label for all kinds of ailments, and successfully so, and not always with a study by FDA to back it up. But it's just another example of how oversight of our boards and licensing boards is also an important part of this, making sure that and we had to pass a bill. We got a bill passed making sure that off-label use of drugs is legal in Arizona. It shouldn't have to be said, but it did in this case, and physicians should be aware of that. They have that protection in Arizona. But on the ground, they might not know that. And so, you know, I think as a legislator, I respond to what I hear on the ground from patients and from physicians and their experience, and where government really can do better, and try to deal with what those barriers and regulations are doing to inhibit patient care and better health care in Arizona, whether it's through Medicaid or in the private sector.
So
Yeah.
I'm sorry, go ahead, Dr. Katz.
Yeah, sorry. And not every naturopathic doctor treats children, but a great many of them do. But I mean, from personal experience, as well as from all the ones I know, we love treating children because we know we're going to prevent a lot of down the road problems that they will be dealing with based on what they're coming in just as a small child. Even like some of the most common things, again, are GI issues with children. You know, whether it be colic when they're really little, they develop acid reflux, you know, a lot of different things when they're really young. You know, their parents take them through, and that's never cost beneficial to the state or anybody. But they take them to their GI doctors, they take them to allergists, and they do a lot of different things. And very rarely, especially the GI side, they never check food. You know, they never do food testing at a GI doctor. And think about that from a logical standpoint again, that it's a GI doctor, you're putting food in your GI tract, but we're never going to test what that food's actually doing. Instead, they're getting scoped with colonoscopies. They're getting surgery to remove parts of their colon. I know teenagers that have had parts of their colons removed because of Crohn's disease that we got in remission, finding out the food sensitivities that they were having. So it's like we love treating children. I think it was the health secretary at the White House. I'm pretty sure he came out and said that one of the biggest reasons, like with COVID, why so many people are sick is because we have so much chronic illness in this country. Well, treating children can prevent a lot of these problems. Almost half the country has a chronic illness. So when you're thinking about pre-existing conditions, almost half the country has a pre-existing condition. And over a third of them have more than one. I mean, we're talking 100 million people plus are considered pre-existing condition in this country. That is devastating when we're talking about, you know, overall health care.
So you're talking about COVID-19, the risks for older folks, but also for folks who have chronic illnesses are immensely greater than if you were, younger, of course, but also healthier, correct?
Yeah. And
so the idea then is that if you can get more people to be healthier and not have chronic problems, then we will not see the same number of, folks having these grave complications, correct?
Exactly. And on top of that, we're just, we're missing the point when it comes to overall treatment. Again, it's always about, symptom. It's always about, how to do this. I mean, there's so many drugs we can all watch the commercials. And of course, there's outliers to every situation, and the media is very good at, expressing all those outliers, very well, especially with COVID. But you can watch all the commercials on drugs and new drugs and everything going on there. Some of these drugs they're using now for stuff like psoriasis, rashes, they're using drugs that they say in the commercial can cause cancer and heart failure. So again, I understand rashes aren't fun. They can be uncomfortable. They can look bad, whatever it is. But to treat that with something that can cause heart failure and cancer doesn't seem to be practical. And most patients don't understand that when they're prescribed these medications. They're strictly focused on, I have a rash, get rid of it. But the idea is how many times do we see where the treatment is worse than the disease? And we have to get more in, why is this person having psoriasis? Why is this person having, really bad complications to COVID? Why are they having, parts of their colon removed as a teenager? It's strictly about cause, and all we focus on in this country most of the time is disease management care.
So let me go to some of the questions from the audience. I think there's already a lot of them. I guess this one is for Representative Barto. I think you kind of hinted on what you would be doing next year in the state legislature, but are there any, so here's a question from Phyllis, are there any initiatives in the legislature this year dealing with healthcare, including changes to the healthcare model? And I guess that's for next year, because that's when you go back into session.
That would change the healthcare model?
Yes. Well, let me just modify the question then. Like, what do you hope to introduce next year, and what do you hope to see happen? I guess more specifically in terms of perhaps the scope of practice, and I guess more broadly speaking, right, access to healthcare, expanding access to healthcare.
Well, I think we will take another look at this. Some of the initiatives that we worked on in 2020. That our legislative session was cut short, and our bills only made it halfway through the process, if at all, due to the shutdown. And so I'll be looking at bringing those issues back up. A couple that I mentioned was, I think it's Bill 2314 that is specific to NDs, and allowing them to do a number of things in statute. That isn't a specific scope of practice. It's not a sunrise issue, I should say, where you have to go through that process to get this bill done. So that's one. And also the physician and training issue deserves a lot of, I think, a lot of discussion right now when you're talking about physician shortages and it really is an issue in Arizona. So there's really no reason why we shouldn't at least take a real serious look at how we can include those medical students who have graduated and get them on a path so that they are starting to pay off their loans, number one. It's very discouraging if you have to take a job it's not going to even support that aspect of going all through your 8 years of medical school, and then you might not get matched for several years after that. And so we can't depend on GME for that. So those are a couple of issues, and we'll keep pushing for the chiropractic care, and I think whatever other ideas come, my door is always open to discussing new ideas on how we can better expand access in some way.
So
Luigi,
here's go ahead, Dr. Bishop.
I just wanted to address a few that came through on like diversity and serving the underserved. And SCNM, our school in Tempe, has multiple community clinics. We have one in the Hamilton School District, we have one in the Roosevelt School District, and those are free clinics to the public because naturopathic medicine sort of lends itself to serving those underserved populations. That's all funded by the SAGE Foundation. So we have some great community clinics to help those people And as far as the food insecurity questions that were coming through, I do think that is something as well that's high on our priority list to address, because we understand the benefit of food, but we also know that some of those communities don't have access to it. And I wanted to share one real quick story. I did a talk over at Estrella to some of the Girl Scout troops. And what we did is we took food, like we had a root of ginger and things like that. And what was really interesting in that population is those kids knew what that treated. They said, oh yeah, my grandma gave me that for asthma, or oh. And when I talked to the moms, when the moms came to pick them up, I said, you tell your doctors this? And they said, oh, absolutely not. They would, they wouldn't agree with what we're doing. So it's almost interesting how some of those cultures intuitively know how to use food as medicine. But the food insecurity and educating and getting them access to that is a huge thing. And then can I address one more question?
Go ahead,
did
yes.
You want...
No, go ahead,
Someone, I didn't get to read the whole question, but someone put something about naturopathic scams and how much information is out there. And I think it's really important to a consumer. And this is why we fight so hard legislatively, because we need the consumer to understand that there is a difference between a licensed naturopathic physician and a naturopath. And the difference is there's 7 schools that are accredited in the United States and Canada where you actually have a physician license, meaning you can diagnose and treat. There's multitudes of online schools where you can learn herbal medicine and homeopathy and nutrition, but that's an online degree, and you cannot diagnose or treat, meaning you can't prescribe medications and you can't do some of those things. So I think it's vital, and for safety, we have to make sure that the consumers understand that differentiation. Not saying that a lay naturopath is bad in any way. They definitely have value. I just think it's a big distinction that for consumer and patient safety has to be made. And so I'm really glad that someone brought that up.
So just to be clear, naturopathic physicians go through an accredited medical school in which, of course, you get your training, you get the knowledge, and then you're licensed to practice in the state, which means you can treat, diagnose, and treat a patient. Correct? So that those are the key distinctions.
Yes, absolutely.
Yeah.
So, I'm sorry, go ahead, Dr. Katz.
Yeah, and not every state is licensed as physicians. It's one of the goals of the American Association of Naturopathic Physicians, and of course every state with them, is our goal is to get every state licensed. We say this as a protection to patients. It's like having states licensed to regulate the physicians will get rid of the doctors that are calling themselves naturopaths that aren't doctors. So the patients don't understand that. The patients go see someone that calls themselves a naturopath when they never went to school to be a naturopathic physician. So technically they can literally be treating people and have, little to no training involved with it, but because the states don't regulate the actual term naturopathic physician, the patients don't know the difference. Now in Arizona, we're protected because we have the licensure. Now, when we go into other states and try to get them licensed, MDs tend to be the ones that fight that regulation. And then they say it's because of patient safety, they don't want to have naturopathic doctors licensed. And yet it's the exact same argument on why you should have them regulated is for patient safety, but they're not actually looking at the right issue.
So here's another question. How do naturopathic physicians incorporate dental health in their treatment of the whole person? Of course, dental health, that's, you have to go through several years of schooling to be a dentist, of course, but what are your thoughts on incorporating dental health in your treatment of the whole person?
Well, I mean, treating the whole person is always going to make less chance of even getting cavities and gum disease. That doesn't mean if you eat perfect, you're not going to get cavities and gum disease either. But even if you go look at the ancient skulls, where they weren't eating processed food all the time, they didn't have a lot of cavities. So it's like the idea is it's still about diet when it comes to immune system. A cavity, it's a bacteria. So if our bodies can handle and get rid of it, it's going to be able to, have less chance of gum disease and cavities, as well as, you have probiotics in your mouth every bit the way you have it through your entire GI lining. There's certain probiotics that actually protect your body from strep mutans, which is the #1 bacteria that causes gum disease and cavities. So if you have proper good flora in your mouth as well, you're going to have less risk of having cavities and gum disease. So it's all connected for sure.
So I guess we only have room for one more question. There's a question here about obesity and diabetes. Of course, that's a real pandemic. We've faced that for decades. So here's a question from Scott. Hundreds of thousands of kids are obviously not learning wellness either at home or at the pediatric clinic. This is, of course, an assumption, right? But we keep slashing physical and health education. Why aren't we using the schools more to develop healthy habits for life so that children leave school capable of and motivated to take personal responsibility for their own health? Dr. Bishop, you want to take a crack at this?
Oh, geez, that's like a loaded question right there. One thing that I found out within the school systems is some of the schools were putting in Pepsi and Coke machines and vending machines with horrible food. And when I questioned it at my own children's school, I found out that they were getting funding from those companies to allow those vending machines to be in there. So again, like Senator Barto said, it's sort of follow the money type of thing. As far as personal responsibility, that's why we do what we do, because when we start with a family, it branches out. You know, when we can get mom and dad healthy, they in turn raise healthier children who go with healthier friends, and it spreads out through the community, sort of the ripple effect. So I'm in complete agreement with you. We need to have people be responsible for themselves. And until the consumers kind of start pushing back on that a little bit, it's really an uphill battle. Luigi, can we end with a few things to prevent COVID?
Yes, let's go ahead and do that. Yep.
Okay, so I'll cover it, and then Dr. Katz, but Senator Barto also said something earlier about sugar. And I think it's notable that when you eat high sugar foods, it does decrease your immune system for up to 4 hours after eating those sugary snacks. And make sure you're thinking about drinks. You know, a lot of times when I go through Starbucks in the morning, the people in front of me are getting what I call the foo-foo drinks with the whipped cream. And, you know, there's more sugar in there than you should probably be having for the whole week. And a lot of people call it their coffee, right? So, you know, we just have to be cognizant of the amount of sugar we're taking in. Make sure your immune system's boosted. And someone put in the chat, you know, we can Google that. But for sure, vitamin D, vitamin C, look at quercetin. Quercetin is showing some really good research specifically against COVID, sort of in the same way that the hydroxychloroquine pharmaceutical was. Elderberry, some of those antiviral botanical medicine type things are great. Sleep is super important, because if you're not getting a good night's sleep, that's when your body rebuilds, and that's when your immune system is able to function. And then for sure, anxiety. When you're under stress and anxiety, you're pumping out different neurotransmitters, different things that prevent your immune system from being optimal. I know that's a difficult one to deal with, but wanted to throw it in there. So thank you very much, Luigi.
Yeah. And zinc, of course, I don't know if I heard
Zinc.
that one. Zinc
I did not
huge.
say zinc. Yes.
But I want to end, you know, basically, you know, again, we're the Arizona Naturopathic Medical Association. We care about safety. We have lots of doctors in this state that are licensed naturopathic physicians that take great care of whole families, geriatrics, you name it, we treat it. Of course, not every doctor has a specific, I mean, every doctor has their own specialties, but, you know, if you go on aznma.org, you know, we have a find a doc there. And so you can find a naturopathic doctor near your area. It talks about what they treat on the webpage. So you'll be able to, you know, really start to get your wellness and start protecting you and your family moving forward. So thank you so much, Luigi and Representative Barto, for coming on this as well.
Representative Barto, you have the last word, I guess, ma'am.
Oh gosh, thank you so much, because I really wanted to end with this. You know, I think it's having more patient options begins with protecting patients' medical freedoms. And I think, you know, we really need to keep that in mind as representatives of the people our primary job is to protect individual rights. And medical freedom is a very important part of that. So, you know, I saw a question in the chat about mandatory vaccines and masks and things like that. You know, government shouldn't have a place where we are mandating certain healthcare treatments for every individual. There needs to be choice, and there needs to be medical freedom. And so, you know, when there are laws that inhibit those, that's a huge red flag. And I think people are waking up to, you know, in a health emergency like we've been under for the last few months, they're looking at, well, where is this going? And so that's going to be a focus as well in the next session, I'm certain, because nobody wants to see a pandemic ever again. And we all want an easy solution. But there is no one size fits all for everybody. Everybody's an individual. And in this country, we stand or we fall, whether or not we protect individual rights, and that includes medical freedom.
And with that, Dr. Bishop, Dr. Katz, Representative Nancy Barto, thank you again for spending the morning with us. And to our sponsors, the Arizona Naturopathic Medical Association and Arizona Governmental Affairs, thank you for engaging with us this way. And I guess I'll see you around.
All right. Thank
Great.
you.
Thank you.
All right, to our audience and listeners, thank you again for the time, and enjoy the rest of your day.